Okay. Okay, looks like I'm live. You guys, my team is making me be fancy. So I am on Instagram. Hello, hopefully this goes seamlessly. And I'm on Facebook also. So it feels so good to be back home. I have been traveling because this is my speaking season. So I do a lot of teaching and mentoring and speaking to senior dental hygiene students. But it feels so good to be back in my office. So my name is Carmen. I am a myofunctional therapist. I am an educator. I am extraordinary. So I do all of this stuff. So I am super happy to be here. My new blog came out today that was about all things frenectomy. So in this session, I'm going to be talking about the most common questions that I get from my community for regarding questions about a frenectomy. So let's just jump right into that. So I have I have 6 questions here, which are the biggies. So the first one is why pre-procedure therapy? So if you guys have been following me for quite some time, or any time at all, you know that I talk about this because it's so important. And yet it frustrates me so much because there's so many people out there who have no idea about why they should do pre-procedure therapy. I have 12 people on my schedule this week for exams that had no idea. They already had their frenectomy done. So let's talk about why pre-procedure therapy. So you're going to go to a doctor who is going to do your frenectomy. They're going to do it. Not all of them are going to tell you about needing pre-procedure therapy. They may not tell you anything about myofunctional therapy, okay? The most important reason is we're going to start building strength, we're going to start building coordination, and we're going to start building awareness. My goal with my clients is that once you release the tongue, then it just pops to the roof of the mouth. So that's the habit. That's the normal thing. The other thing is when you do pre-procedure therapy, it's really no different than maybe getting a little bit in shape to get a new hip. Or if somebody's going to have surgery and the doctor tells you have to lose some weight, that's really no different. It's going to make the procedure better. The doctor can do a better job. The wound might be smaller. It's going to be so much easier. So one of the things that I want my clients to be able to do is what we call a suction and hold. I don't have a tongue tie, so don't email me saying I have a tongue tie. I have 100% range of motion. Again, if you follow me, you already know that. I just have a very pronounced frenum, which everybody has one. So anyhow, going back to the suction and hold. That move, if you can suction and hold for 20 seconds, that's what I want. So I want you to be able to suction the tongue up. Look at how easy that is going to be for the doctor, and he's going to be able to do the procedure a lot easier. Now, what I have found with my clients is that some of them have trouble suctioning the tongue up once it's numb and once they get tipped back in the chair. So it's really important to have a good solid suction. So that's kind of what we go off of. That's one of the things. So pre-procedure therapy, just to sum that back up, helps you start building strength, coordination. We get some movement in there. A lot of people, that tongue is just laid around because it's never worked right. For some people, it's really uncomfortable, so of course I have to take that case by case with every client. But it's going to help the doctor do a better procedure. It helps them out for sure. The next question is, what if I can't afford it? So this is a hot topic. It's always a common question. I see it in a lot of the forums I'm in, Facebook groups, that kind of stuff. Really, I can only speak for myself. So I have a ton of different programs that are very different financially. So remember, I see people all over the world. So $1 in the United States is very different on the other side of the world. So I have a lot of programs that make it affordable. For an adult, you do not have to rush into this. Children, it's a little more important for sure. At least I feel that wholeheartedly. But I tell my adults, do not rush into this. If you don't have the money to do the proper pre-procedure therapy, then save the money. You are not sitting in a room on fire, so you can wait, you can do it right. If you can't afford myofunctional therapy, the first reaction of a lot of people is to go out there on the internet and see what's out there. Go back and look at some of my blogs about doing YouTube therapy. You're going to find a couple things that will demonstrate maybe 1 or 2 exercises. You are not going to get the step-by-step framework that gives you an organized path, that gives you how to do all of the steps. Everything builds on one another. So not only are we building strength, but when we start moving, especially when we start moving into the swallow, it's really important that we have those steps. So if you go out on the internet, you're going to find some stuff, but free stuff doesn't give you the whole enchilada. So save the money, do it right, or check with me, somebody else. Ask your myofunctional person what their programs are, how they operate, do they have discounts, what can they do to help you get the therapy that you really need. So if you don't ask, you're never going to know. Okay, third question. Will you help me find a doctor? I get this question a lot, even from people who aren't going to be my client. So I don't help you hand pick your doctor. I guide you. Now, with that said, I do have the Tongue Tie and Myofunctional Therapy support group. There's a lot of great community members in there that can give guidance. I am working to get a provider in every state. And when I say that, that is such a tall order because I personally interview these doctors. I make sure that our practice philosophies align. I make sure that they recommend myofunctional therapy. I make sure they understand what it is that I do, because what's the point of working with them if they don't support what I do or if they have no idea? So I personally talk with these doctors. I learn everything about their procedures, their protocol. I share with them about mine, how I work with my clients. You know, I work with people all over the world. So obviously I'm talking about people here in the United States, but it's still important that I know how a doctor works if I have somebody traveling in. Okay, I have a provider here in Colorado that I have clients travel from 5 states away to see. So it is really important for me to know what it's going to be like when that person flies in. I also have to have a very trusting relationship with that doctor so that I know, and so that he knows or she knows that I have adequately prepared this person. Okay, and same thing goes for clients who come from out of the country to the United States to work with some of my providers. That's a huge thing, so it's important that I make sure that they're prepared. So in a nutshell, I'm not going to help you. I'm not going to hand pick your doctor. I'm going to guide you. I might already be working with people. I might have colleagues in a different area that I can help with. It's a small world, really, so I have a lot of connections. If I don't have anything, I mean, I'm not going to just be like, hey, whatever, you're on your own. I have a couple blogs recently, I don't know how many weeks ago they were, but they were pretty recent, where it talks about considerations for choosing your doctor and questions to ask your doctor. So I definitely guide you through that path. Okay, the next question, what is your process? Meaning, so what is my process? So I talked about pre-procedure therapy. So the process with me in the big picture is, first you can do a 30-minute assessment, which is a free visit. That gives you a chance to meet with me, see what it's like to do therapy like this on Skype. It gives me a chance to talk with you and answer your questions and ask you questions to make sure that it makes sense for you to pay for a comprehensive exam. The last thing I ever want is somebody to pay me for an exam and then me tell them, you're fine, you don't need me, you're good to go. So I never want that to happen. It never has happened. I never have had somebody come to their comprehensive or to their assessment and me say, or their comprehensive exam, and me tell them that they're fine. So, but that's an option. So everybody can start with a free 30-minute assessment. The next step is a comprehensive exam. That's mandatory. It helps me identify your needs. It helps me educate you so that you know why you need therapy. You have to see the value in it and see why you need it, or I'm not working with you, because I don't want to dread working with somebody who doesn't think that they need help. So that's mandatory, the comprehensive exam. After the comprehensive exam, then you're ready to start therapy. Once you decide what program you're going to do, I mail you a kit. You have to do some more pictures with some stuff that you get in the kit, so that's really important. Then you're ready to start therapy. I start all of my clients a month, 4 to 6 weeks before they have their procedure. Then I see them within 48 hours, and that's a rule, you guys. I mean, I have somebody right now getting ready to have a frenectomy in another country that does not have 4th of July as a holiday, and guess who is working? Me. Because it's important, and that's a rule that I have, so I'm making it happen. So that's a non-negotiable. I have to see my clients within 48 hours. I let them heal for 2 weeks, and then after that, we're ready to jump in. So people always say, well, if I've had my frenectomy done, why do I have to do something else? Because now we have to rehabilitate the oral structures that haven't worked right. Your tongue doesn't work right, especially if you have a tongue tie. We know you're not swallowing right. There's usually a lot of impairment and dysfunction, and now that we have that frenectomy done, it's time for us to start moving forward. So that's really important. So there's really a couple different phases that are so important. The pre-procedure therapy, then making sure we get the best healing, and then continuing on after to improve the function. So that's my process. As far as the time frame, I am not in a hurry to get you through therapy. So when I was a new therapist, I really worked with 1 week apart, 2 weeks apart. And now, as I have gained so much experience and worked with so many clients, I see no reason to rush you through therapy, especially if I teach you something and it was a struggle for you and you really had a difficult time. Why would I want to see you in a week? I want you to work on that for 2 weeks, maybe 3 weeks. Typically, I don't have somebody work more than 4 weeks. People who have snoring and sleep apnea concerns, they're my hardest clients. They're in my hardest program, so they will be spread out a little bit further. But everybody else, it is completely customized to them and what they need. The next question is, do I give family discounts? I think that would be a no-brainer, but I get asked a lot, so absolutely yes, I do. What I want is I want the opportunity to work with the family member. So I know that people may, and I'm very aware of it, that people, one person will pay for therapy and they all will do the therapy. Here's what I want. When that happens and I'm working group therapy with multiple people, I want to first have the opportunity to examine everybody, because I do not want to be doing therapy for one person and somebody else has an overlooked sleep disordered breathing concern, they need referred for sleep apnea, that kind of stuff. So I make everybody have a comprehensive exam so that I can see what I'm working with. Then I can do groups, I do group discounts. I really do like to work individually if possible, so I will offer a discount so that I can get the opportunity to still work with people individually. All right, last question, you guys, is stitches or not? So, and I suppose right with this, I should put scalpel or laser. Yeah, I mean, I get this email so much. So first of all, it's more important that your provider know what the heck they're doing than how they're doing it. Okay, so the provider expertise and their knowledge is the most important thing. So it doesn't matter how they're doing it. I have doctors who do it all different ways. I have doctors who do laser and do stitches. The question I wanted to answer here is stitches or no stitches. So from my standpoint as a myofunctional therapist, I don't like stitches because they prevent me from getting my clients moving with that functional movement that is so important. However, with that said, I know how important it is for those stitches to be there in a patient who is not going to be compliant, who's not going to do their stretches, who's not going to wake up around the clock to take care of their wound and to do that active wound management that I have talked endlessly about also. So when I have somebody who has stitches, I still make sure that I see them within those 48 hours because, again, that's how I do it. But what they're going to be able to do for those first few days while they have those stitches is going to be less than a client of mine who does not have stitches. So I kind of have to just take that on a case-by-case basis and deal with it as it comes. But for my clients who ask me that question, do you want me to have stitches or do you not want me to have stitches? Again, I always say it's up to your provider, but some of my providers give the option. I have some providers that if you say, you know what, I'm totally going to own this, I'm going to be responsible for doing my wound care, I'm in myofunctional therapy, I'm going to be doing all the things, then if they have an option, then no stitches. But I have some providers who have started putting stitches in because clients don't want to get up around the clock or they don't want to do what they're supposed to do. So I guess to answer the question, if you're the person who emails or wonders this and you're wondering if you should have stitches or not, determine if you're going to follow through, if you're going to do what you say, because that's the important thing. It makes my job harder. In the end, it's fine. The most important thing is that we get proper healing, because I can help you recover from a lot of stuff, but I cannot help you recover from a crappy healing job. Just not going to work. Okay, so that wraps it up, you guys. Next week, I'm going to be talking about how connective tissue plays a role in your body tension. So I know this is a huge, huge issue for all of you guys. So we're going to be talking about that. Next, let me see here, get my mouse working. Let's talk about the quick assessment tool. So for those of you on Instagram, you don't have this link here, but at Myofunctional Therapy for you, that's the number 4, the letter u.com /blog. At the bottom of any one of my blogs, you can get a free assessment tool. This assessment tool, you guys, is the place to start. If you're like me and you like to talk yourself through things or research before you contact somebody, then do this, because this assessment tool is what my partners, my provider partners, use all around the world. It's 25 questions. It's going to help clue you into whether or not you have a concern. It's free. Get it. Then you can decide if you want to schedule a free 30-minute assessment with me or somebody else. It doesn't matter that it's me. It just matters that you do something about your impairment. Okay? So you can do that. The other thing is, you can also schedule a 30-minute assessment. It's free. We meet on Skype. You get to meet me, see if you could stand doing therapy with me, if we jive. It needs to be a personality match. So you guys, that's totally free. You can do it. All right, and then last thing, huge favor. We are growing. You guys know that, and it's so exciting. I love it. So I have the tongue tie and myofunctional therapy support group. So my favor to you guys, because my team and I work, overall we work in wellness. So I work in connective tissue, I work with breathing, I work with sleep hygiene, I work with so many different things. So myofunctional impairment is huge, but overall it's the umbrella of wellness. So I want to reach more people than those who just have tongue ties. So do me a favor, share us, like us, follow us. I have the tongue tie and myofunctional therapy support group. We're on YouTube. We're small and mighty. We're growing. I have the Facebook. We're on Instagram. So that will help us out. Again, next week, I'm going to be talking about connective tissue, how it plays a role in your body tension. So thank you guys. It's wonderful to be back, and hopefully both of these lives worked. So I will see everybody next time.